I'm Nikita Chauhan. Today's my topic is the blood pressure. Blood pressure is the pressure of circulating blood, circulating blood against circulating bugs against the walls, blood vessels. Then the most of these pressures, adults pressure results from the heart pumping blood through the circulatory system. Then the sagometer is has a three parts of the cuff that can be inflated with the pressure meters, manometers for measuring air pressures in a cuff, and a stethoscope is measured. Stethoscope for listening the sound of pumping heart. Heart blood makes heart flows brachial, then the recording of a recording the blood pressure. Then the blood pressure is recorded for a number of reasons to requires a to require baselines, and the monitor of for fluctuation in blood pressures and the second is to aid in diagnosis of disease, to aid in to aid in the cardiovascular system, the assessment of hypersensitive to drugs, systolics and diastolics pressure. The two types of pressures is the one is the systolic pressures, and second is diastolic pressure. The systolic pressure is the pressure of the blood in the arteries when the heart pumps. It is higher of two bloods pressure measurement. For example, if blood pressure is 120 to 80, then 120 is the systolic pressure, and the diastolic pressure is the pressure of the blood pressure of the blood in the arteries when the heart is filling. Then it is the lower of the two blood pressure measurement. For example, if the blood pressure is 120 to 80, then it is the diastolic pressure. Then physiology of arterial blood pressures. And then physiology of arterial blood pressure. Blood pressure is reflect the interrelationship of cardiac output, the peripheral vascular resistance, blood volumes, blood viscosity, artery elasticity, and then the cardiac output, the amount of the blood heart pumps through the circulatory system in a minute. The amount of blood put out left ventricle of the heart in one contraction is called as the stroke volume. The stroke volume and the heart rate determine the cardiac output. Then a normal adult has a cardiac output of 4.7 liters of blood per minute. Then the peripheral resistance is defined and measured in terms of the force required to maintain blood flow from the root of the aorta to the venous exits into the blood. Then the blood volume refers to the total amount of fluid circulating with the arteries, capillaries, veins, venous, and the chambers of the heart at any time. The component of that add volume to blood include red blood cells and white blood cells. Red blood cells also called as erythrocytes, and white blood cells also called as leukocytes, and also platelets and plasma is included in blood. Then viscosity, resistance of fluid to a change in a shape of movement, neck boring, proteus, hemostasis. Then it is normally 40.7 to 50.3% in males, for males, and 36.1% to 44.3% in females. Then elasticity is the is the ability to recoil or bounce back to the muscles original length after being stretched. Then the average optimal blood pressures. Then the newborn in age of newborn, then 40 means, and 1 month has 85 to 54, and 1 year 96 to 65, and 6 years 105 to 65, and then 80 years and older, there's greater than 122, greater than 80, less than 182, less than 122, less than 80. Then blood pressure oscillatory method. The avoid patients to cheer with the lower than the supported as before. The blood pressure cuff patient's right arm the diaphragm is placed. Then the oscillatory method is used to measure the blood pressures. Then the sounds are called as Korotkoff sounds. Korotkoff sounds is pressured is lowered further. The character of the Korotkoff sounds should change, and at some point the sound will be disappear. The patient should no lie on his or her back for 5 minutes. The systolic pressures and diastolic pressures. Then the first sound here, sharp third systolic pressures, soft tapping, intermediate load and the rains. Then hormone regulations. Epinephrine and non-epinephrine hormones secreted by the adrenal medulla raise blood pressure by the increasing heart rate and the contractility of the heart muscles, and by causing vasoconstriction of arteries and veins. Hormone regulation. Angiotensin second is powerful for vasoconstrictor, greatly increasing blood pressures, and factors of the blood pressure influence. The smoking, being overweight or abuse, lack of physical activity, too much eat food from diet, oily foods. Then stress, older age, genetics to hypertension is defined as the blood pressure above 142, blood pressure about 140 to 90, and is considered severe if the pressure is above 180 to 120. Then high blood pressure has often no symptoms over time. If untreated, it can health conditions to such as heart disease and stroke. Hypotension means low blood pressure, and hypotension is orthostatic hypertension. Lower extremity blood pressure is the cuff should be placed 2.5 cm above the orbital surface. Along blood pressure is the causes and the treatment. Avoid the blood pressure. Avoid the smoking, overweighted, junk food. Eat every day after day, and low exercise that cause of hypertension and hypotension also. Prevent from this disease cause or regular exercise. Prevent from hypertension due to daily exercise, healthy diet, and meditation is also helpful for the hypertension. Control the pressure of blood. And thank you.